Okay. So excited about today. Hello, everyone. Welcome. We're going to give people just a couple minutes to join before we get started. If you don't know where you are at the PEDIGREE Foundation and Shelter Animals Counts third installment, Stephanie, of the Dogs and Data webinar series. Third? Yeah. And we are here covering all topics related to medium and large dogs in animal shelters who are having a really tough time right now. So today is all about safety. So we are happy you are here. Welcome. We're going to wait just a minute and give people a moment to join. We have already about 100 people in the room. And what's really exciting is we have about 1,700 people registered for these webinars. We are not typically sharing recordings for these. So if you want to see what's going on, you got to come. Though we are sharing recaps of the most important information from them. But with 1,700 people registered, everybody's really busy, but we are committed to getting to as many shelters as possible to get you the most important information you really need now. So, oh, hey, Sarah Barnett, how you doing? I see so many people we know. Okay, is it time? Okay. Welcome, everyone. My name is Kristen Hassen. I am here on behalf of Shelter Animals Count with my colleague and partner in crime, Stephanie Feiler, who we are, along with PEDIGREE Foundation, leading this series of webinars really focused on the greatest challenges related to medium and large dogs. And I am so excited about today because we have a truly all-star lineup of people that are thinking about safety in the animal shelter space. And what's really challenging about safety for us right now is that it's not a lens that we've looked through holistically in animal shelters, at least not on a large scale. And we generally measure safety through really problematic metrics like dog bites, which, as you all know, can be fatal or barely a skin break. And yet we just typically call them all dog bites. We measure safety through lawsuits and risk management claims, but we rarely look at the mundane day-to-day things that keep animal shelters safe. And what that often means is that our first answer is like, we are unsafe, we need to go to euthanasia. When there are a lot of other things that may be appropriate in some cases, and there are also a lot of other things we can be doing. And so the speakers that are joining us today are all people who are really delving into asking new questions about safety and looking at how can we at a shelter level and an aggregated level make animal shelters safer for both dogs and people. So I'm going to just run through who's here with us today. We have Emily and Lauren from Dogs Playing for Life, Monica Dangler from Pima Animal Care Center, Jerrica Owen from the National Animal Care and Control Association, and of course, Dr. Kate Hurley from UC Davis Shelter Medicine Program. So we're going to be running through a lot of information with you today, and we will provide a recap after this. So you'll be able to get the high points, and we'll also provide the slides to you at the end. So I am going to go ahead and share my screen now and turn it over to you, Stephanie.
Great, thank you. Well, to set the stage for what we're going to be talking about today, we want to first get into some of the data, particularly surrounding why animal shelters are so full right now.
Is my screen, is that working? Great.
Yep.
All right.
Yep. If you want to do next slide. Do you want to cover the safety assessment or come back to it?
I'll cover it really quick. If you're wondering like how to take away, like what can be a takeaway from today, because you're going to hear a lot of great ideas, but this is a protocol. My business is called Outcomes for Pets. And one of the things that I do with a lot of shelters is a self-assessment. We're going to share the link in the chat for this, but this self-assessment is a great thing to do to just run through it and see where do you land on some of this. You may be surprised at how little you're doing. I've never met one shelter that's doing all of it. That's not the idea, but it'll help you gauge where you're at when it comes to safety. So we wanted to make sure to mention that at the beginning because it's a great exercise to go through regardless of your organization.
Great. Okay, so we've talked a lot about intakes, outcomes, all of the reasons why both of those things are occurring. And what we want to talk about mostly today is focusing on the median length of stay, particularly in this case, looking at median length of stay prior to a dog being adopted. So as a reminder, length of stay is the calculation of number of days after an outcome is finalized, where days in care is a running total of number of days while the animal's still in the system. So when we look at the median, for length of stay for dogs that were adopted by size. This is the trend over the last 6 years for small dogs, small breed dogs in particular. So you can see that even small breed dogs from 2019, every year since has started to tick up, starting with, I think, about 9 days. Can you advance it and see if that data comes across? Oh, actually, go back. Go back one more. Yes, thank you. It's about 9 days, all the way up to about 14 days. So the increase right now from pre-pandemic to 2014, just looking at Q1, we'll be releasing year to date through June data here in the next few weeks. But just looking at through Q1 of 2024 compared to Q1 of 2019, for small dogs, we're seeing a 50% increase in their length of stay. If you want to go to the next slide. Then when we look at medium dogs, they kind of kept pace with small dogs until really last year, where they really shot off and were experiencing a much higher length of stay than small dogs. So we're seeing their increase compared to 2019 at 80% more days before they're adopted. Next slide. And then large dogs. Large dogs has always been higher than the other two size groupings, obviously. But also in 2023, even a little bit more in 2022, they really started to separate from small and medium dogs to in 2024, they're now double. So 100% increase for large dogs who were adopted. It took them twice as long from the time that they came into the shelter till the time they left. What's interesting in 2024 is when you look at all three size groupings within the same year, you can see that that change of the small and medium creeping up towards the large dog. And so it's important to note this because while, years ago we talked about cats being the challenge in shelters, and then recently we've been talking a lot about large dogs, we should not talk about small and medium at that same time because they all are experiencing an increase. 50% for small dogs, I was shocked to see when we originally had started looking at this data. So really we should focus on areas of animals, species, and age and size, et cetera, that are the most at risk, but not assume that the others are okay, because we're really looking at all animals across the board. And the same for cats. Cats are having a lot of wins in a lot of areas, not in all, but we shouldn't consider that one a win and moving on to just solely focus on one part. So with that, I will put in a link to a webinar that we had done recently called Where Have All the Dog Adopters Gone? That highlights some of these 3 slides and a whole host of others. And we'll, like I said, have the year-to-date data coming soon.
Thanks, Stephanie. So with length of stay going up, we know that what creates unsafe conditions in shelters is animals under extreme stress for longer periods of time. So there is already a concern about safety because of simply length of stay. And yet we haven't had great ways to look nationally. And when we think about SAC data, like we haven't had any necessarily safety focused metrics that really hone in on how this may be playing out both in shelters and community. And so Jerrica Owen is joining us from NACA to talk a little bit about the collaboration between NACA and SAC around data.
Fantastic. Thank you, Stephanie, Kristen. Hello, everybody. I'm so happy to be here. My name is Jerrica Owen. I am the Executive Director of the National Animal Care and Control Association. And we're thrilled to be here and to talk about some of the things that we've been talking about, which is the need for national data as it surrounds field services. So if you want to go to the next slide. And sorry, you can click all the little buttons. So we know that local data is extremely, back one, yeah. So we know that local data is extremely crucial for addressing immediate and specific issues, but we want to talk about national data and the vital role that this plays in really providing a broader perspective, which is going to help facilitate comprehensive strategies for animal care and control across the nation. So Stephanie and I started talking and realized that there is a gap and that this would be an amazing opportunity for us to collaborate and to figure out how can we, look at national data trends utilizing the Shelter Animals Count database. So the reason, behind this is that by looking at national data, we're going to be able to identify trends that will help us inform policy development, which will then also help ensure and inform equitable resource allocation, support public health and safety initiatives, which is why we're here. So by fostering collaborative research and public awareness, national data is really going to help us build a more effective and coordinated approach to animal care and control, which is ultimately going to lead to better outcomes for animals in their communities. So on this slide, you can see the framework that we have identified. A cohesive national framework for data collection is going to be crucial because it will help provide an accurate and comprehensive picture, right? We just talked about this big picture of national trends. And currently, we know that the data is captured in a bunch of different ways, right? Depending on what software you have, depending on how your agency categorizes the different priority levels, the different requirements for compliance and enforcement. All of this really leads to inconsistencies and gaps in our understanding. What does one community look like in comparison to another community, right? It's kind of apples and oranges. So by putting together this national framework, we're hoping to work towards some alignment and consistency. So this framework, as you can see, is categorized into 3 main buckets, which we determined capture the majority of animal control calls. We did have a task group, and this is where we looked at a bunch of different shelters, and these 3 seem to capture the majority of calls. So regardless of the specific priority or the nature of an incident, we found that we can classify it within one of these 3 groups. So this standardized approach, we're hoping will help simplify data collection and allow for better analysis and comparison across the regions. I will say this framework is just a starting point, and it really provides us a solid foundation for improving our data accuracy and consistency. So as we pilot this, continue to tweak and are going to be, seeking feedback and real world application is going to kind of help us inform as we move forward. Next slide. So the future discussions that we want to have and that we know we need to continue to have to be able to better inform the things that we're working on and looking at, our data standardization. Like, how can we consistently ensure the accuracy in all the different data collection methods, right? This will help us inform and look towards maybe some national guidelines on data collection. What training and education do we need to ensure that everyone's capturing things, that we're able to work towards standard data integration? And then we have data quality, right? We know that there are challenges in standardizing and collecting practices. So what is the inconsistent and incomplete data sets? What are we missing? And so, right, where are the technical barriers? Where's some of the integration barriers? We know, again, I mentioned that different areas, right, use different softwares and capture different things. And so how can we make sure that that feeds into the quality of our data? And then data utilization and analysis. Once we have all this data, hopefully we have some amazing data. What is it telling us? And how are we going to take that? And what are we going to do with it? So what trends can we identify? How will that influence resource allocation and policy development, right? Maybe what programmatic changes do we need to make? So all of this is where we're hoping to continue our discussions. And my last slide is... Sorry, a really loud car just went by. The timeline and next steps. So I mentioned this was something that Shelter Animals Count and NACA have talked about. We've been working on, and what we're hoping to do 2024 is, again, just continue to work on this framework, build the foundation, talk to those who are doing the work. For 2025, look at some data collection initiatives, And then 2026, look at the technology integration APIs, and then moving forward from there, the analysis and the reporting. So lots of amazing things that we want to do, that we know we need to do, and we are working towards it. So that's all I have for you all.
Jerrica, are you, one of the questions that comes up around safety is that these definitions that we use in field services are contested. They're different in different organizations, different communities, different states. So dangerous, vicious, deemed dangerous, aggressive, all of. Are you aiming, as SAC has done sort of an animal welfare glossary, as part of the aim of this to actually define that terminology?
I think it can help inform any decisions and any things that we do want to do, right? Because without knowing what people are already calling dangerous and what they're already calling vicious, we need to understand sort of where we're at to understand and see where we want to go. But yes.
And how can people get involved?
Once we start to kind of move forward, so we do have a data committee that is a collective group of a lot of those invested that are collecting data at the state level, at the local level. And so once we move forward from there, we may have some pilot programs we need to run. If you have fantastic data that you're capturing that you want to share, we'd love to see it, your template. We'd love to see your template. So yeah, great. Reach out.
Put your, if you can put your email in the chat. Thank you so much.
Thanks.
Stephanie, do you want to add anything to that, given that it's a partnership between you all?
Yeah, sure. We're just really excited, especially excited if, for those of you who have followed along in the data collection journey on the national level, SAC has generally led a lot of these conversations and then built the infrastructure to be able to receive it. And what we're really excited about for this partnership is that it's really being led by NACA and the NACA members. And we're going to be then supporting what they come up with and work together on the implementation and next steps. So it's a really exciting partnership. We're excited to tackle this next level of data collection and being able to look at the data from another way. And stay tuned. We'll continue to update, but this is only really, I think, the second time we've talked about this on a public forum yet. So it's still very, very new and developing, and y'all are among the first to hear about it.
Thanks. We're going to turn now to Dr. Kate Hurley to talk a little bit about capacity for care in this moment. Those of us that have been traveling to shelters around the country, the number of shelters and the criticality of the capacity issues is really astounding in some places, and it's a huge issue. We wrote, recently SAC released a blog featuring Dr. Hurley and Dr. Kristen talking about capacity for care, which we'll put the link in the chat, but it's super helpful to kind of lay out what they mean when they use that terminology. And I, you know, talking to Dr. Hurley about this, who's been at this for quite a while, thinking about how we think about capacity, it's directly related to safety. And so I'm going to turn it over to you, Dr. Hurley, to tell us a little bit why. And I'm going to stop sharing my screen for this part and just let you talk.
So, thank you. Now I don't have to look at myself. I'm so grateful for that. So I think safety is a really interesting lens through which to bring attention to capacity for care and crowding issues. In some ways, it's something that can kind of get attention of stakeholders that may not be receptive to other issues around animal suffering or failure to serve the community or staff moral distress. When we start seeing safety issues, that can be a time to really bring attention to and what is often an underlying crisis. So in my experience, we can have safety issues even when a shelter is within capacity. So it's important to have some baseline policies and practices in place to maintain safety. We cannot not have safety issues when a shelter is over capacity. So safety issues are one inevitable expression of a shelter being over capacity. And there's a tendency when a shelter is over capacity, one of the symptoms is increasing numbers of safety-related incidents. And there's a tendency to like, oh, let's double down on the safety, that symptom. Let's double down on that symptom instead of addressing the underlying issue. And if you double down on the symptom, you put really tight policy and practices in place to address safety, but you don't relieve the underlying crowding, maybe you can get 10% more crowded before you get up to the same number of safety issues. But ultimately, the reason that crowding is associated with safety incidents is that it leaves staff with no good choices to make. They cannot do what they need to do. It's not possible to accurately assess animals in the context of 3 or 4 big dogs bounding around in a run, stressed out of their minds. It's not possible to make wise choices about placement of an animal. You might see that a dog is getting overstimulated, but you can't move it to a quieter part of the shelter because there is no quieter part of the shelter to move it to. There's not time to have the kinds of conversations with volunteers, with rescue groups, with adopters to both gather and transmit accurate information. And so, you know, it's like criticizing a dog for bleeding from an open wound when we criticize shelter staff for failing to address safety issues when they're in a situation where that is an inevitable manifestation of the underlying situation. I think that's an important thing to acknowledge when we talk about safety is the impact that it has on staff. And the other thing that's really important to acknowledge is just that the difficulty of making good choices at all in a situation where you're constantly bombarded by impossible expectations. We were talking a little bit before this began about the idea of how much time is needed for care of animals. And the guideline is minimum 15 minutes per animal per day. That's 0 enrichment. That's just to clean, feed, and make necessary health assessments. I've worked with shelters where we divide the number of actual minutes available for care of animals by the number of animals in care and came up with 180 seconds available per animal per day for total care from staff. And so we see, like, with that amount of time, there's just not the possibility of creating safety. And then shelter staff start getting vilified, and then they start getting defensive, and then all kinds of like hiding of things and not reporting of things. That snowball starts to occur where then there's not even the transparency to understand where the real safety issues exist. So safety is an expression of capacity issues. Capacity issues are an expression of an imbalance between intake and outcomes. And in particular, right now, they're an expression of an imbalance between intake and appropriate outcomes, because we are not, and appropriately so, we are not willing to hasten to inappropriate outcomes for animals. And yet, there are more animals coming into shelters than are able to be provided with appropriate outcomes, period. Not even saying in the available time frame, it's period. When we see the length of stay creeping up, it's because of delay of a decision that shelter staff should never have to make. So I want to first just like talk about the very basics of capacity. And Kristen, you've got to keep me on time here.
Yeah, I will.
The very basics of capacity and like why it's such an issue. I've heard on so many calls and like in meetings with shelters, why are shelters crowded? Shelters are crowded because more animals are coming in and adoptions are down and transfers are down. And even reclaims in many places are down. And it's expressed as like crowding is the inevitable outcome. But in fact, crowding is an imposed response of a system that's out of balance. So I'm going to use a metaphor. You can tell me if this works. When you don't have the money to, and you know, I grew up on Social Security with a single mom. A lot of times we didn't have the money to just meet our basic needs in a month. And when you don't have the money in a month and you have some needs that you need to meet, what do? You know, you put it on a credit card. But does that allow you to solve the imbalance between your resources and your needs? Panelists, I guess you're going to have to answer. I mean, put it in the chat too. Does putting money on a credit card allow you to solve the imbalance between your resources and your needs? It can if it's only for a month and you have reason like the next month, things are going to get better. But if the next month you have the same imbalance and the next month you have the same imbalance, what happens? You put more and more on your credit card, and that's not free. That carries an interest rate that uses up more and more of the resources that already weren't enough to meet your needs. And when we see that length of stay going up bit by little bit every year for the last 5 years, that is a higher and higher interest rate that we're paying. And it is cutting into what was already an inadequate ability to meet the expectations that are being brought to us. There's only 2 ways that shelters can solve an imbalance between intake and outcomes. They can lower their intake or they can raise their outcomes. Both of those require operating within a system that is not so overwhelmed that they're struggling with not just basic safety issues, but they're losing staff. The animals are losing adaptability. They're not presenting in an accurate way. There's not resources. There's not money because it's all spent on dealing with sort of the mess in the middle. So we can talk about the things that go into capacity, and one of them is staffing capacity. One of them is appropriate housing capacity, and that's not just like an appropriate number of animals per kennel, but also an appropriate ability to provide housing that meets the needs of an animal that needs something quieter or something, you know, access to enrichment more frequently during the day is really holistically. What are the needs, you know, what constitutes capacity within the shelter, and what is the outcome capacity of the organization. Now, we can improve, we can reduce crowding by lowering intake, even just a little, lowering length of stay, even just a little, increasing appropriate outcomes, even just a little. And that can set a more positive cycle going, where then there's less on your credit card, you're paying less interest, you have more resources to invest. But if you're still working within a system where the expectation of your shelter is that you will always work to way above your capacity, whatever margin you have over here, you know, you shorten length of stay and they're like, great, take in more or hold on to that one longer. So ultimately, every week that there is more animals coming in than animals going out, you know, you just lowered your ultimate capacity to serve animals. And the next week's going to be worse. And I say within a week because, yeah, sometimes, you know, you bring in animals on Monday, Tuesday, Wednesday, there's more animals coming in than going out. But over time, that imbalance should be resolved on the weekend or whatever is your big outcome days. So that if you know that on a week-by-week basis, after 2-3 weeks of that, you're already on the path where you're spending more than you're earning, you're putting it on the credit card, length of stay is inevitably going to be creeping up, and safety issues will be a manifestation when it gets all the way, you know, to a pretty advanced state of crowding. So that's mostly what I wanted to say. Kristen, is there anything you hoping I would say?
There's so many things that like will be quotes of what you just said, but I think the thing that really keeps me up at night, and I think having been a 3-time shelter director and seeing what's happening in shelters now, is like there doesn't seem a good way to go. And I think what I worry about is that like euthanasia for space ends up being at the end of the line. And what the problem is for right now is that because organizations are funded, especially government organizations, are funded to prioritize intakes, like animal control, intake, they're funded to provide minimum standards of care. And then you look at this massive imbalance in outcomes. Like you've got 1 outcome staff for every 10 intake staff. In light of that, like what do we do to not just go straight to euthanasia for space when we're full?
I know that this is an easier said than done answer. But I think we have to look at the intake side. Because you know, ultimately for the sustainable solution.
Yeah.
It has to be that shelters, to have this not be impossible on an ongoing basis, there has to be some acknowledgement that the outcome side is finite, and is lower than the total need of every level in the community. Just like the capacity of an emergency room is finite compared to the total need, the total medical need in the community. And we don't expect we expect more of emergency rooms than they're able to easily provide, and they are also overwhelmed. But ultimately, there is an extent to which if we overwhelm the emergency rooms with more than they can do, it is not serving either the lower level medical needs or the higher level medical needs. That's really hard when we talk about making triaging and prioritizing intake for the ones that have the highest needs of sheltering. And I'm kind of keeping half an eye on the chat. And I would say the highest needs of sheltering, including foster care, as like making sheltering bigger. But everything that comes into the shelter and foster care still needs to go out the other side. And they still need support. You still need capacity. Maybe less capacity. You don't need a kennel in foster care, but you still need someone to answer the phone when that dog has diarrhea. And you still need to be able to tell that foster home, hey, we do have an outcome. We just need you to hold on to the animal for a week or 2 or a month or 3. So it's hard to say, oh, then should the other animals be just left on the street? But I think that's creating a false dichotomy, right? When we overwhelm an emergency room with every medical issue so that neither the heart attacks nor the hangnails are getting service, but especially the heart attacks aren't getting good service, then nobody is well served. And it also closes our minds to the idea of how else can we serve and how much more deeply, especially with shelters, can we engage the community? So there's a small population, there's a small part of our population that shelters serve that is even bringing animals to us through intake. Most of the communities that shelters exist in are actually already dealing with their problems without involving the shelters. There's a lot of people who don't know that shelters exist. There's a lot of people who don't speak the language of the shelter's website. There's a lot of people who don't have cars. There's a lot of people who don't trust us. Part of the reason that they don't trust us is because we're so overwhelmed that we can't meet some of the needs that the community has. But on the other hand, we probably have 95% of the community that could help a free roaming dog, that could help a dog that needs a home, that could help even a dog with a mild injury if we could give them some help and support in this. And so I know this, you know, at this time when shelters are so crowded, this may feel absurdly optimistic, but at the same time, I think if we don't think bigger, we're just going to keep sort of like trying to work this broken system. And it really, the system has to change. And we saw it with cats. Probably a lot of you saw it with cats. We were trying to find homes for healthy free roaming cats that already had homes and caregivers spread across the community. 1 in 4 Americans feeds cats they don't own, and they were not part of our solution. When we started sterilizing and putting cats back, all of a sudden, shelters had capacity for the cats that really need to access this system. And so I don't have all the answers, but I don't want to keep giving an answer that's just like, it's not the answer we need. It's not going to fix it.
Thank you. I think so. I want the boss is going to have to approve, but she's here, so she probably can. But I really think we should dedicate a longer discussion to this. Okay, cool. So Dr. Hurley, I think just having you back, I think everybody, you can see, I mean, I feel a little emotional just hearing you talk. And I think I was just in Mexico at a government municipal pound where they take this kind of middle road approach for the animals that truly need to come in. The ones that don't. They're treating them in the community. And it was probably the best shelter I've been to in a really long time. This government pound in Puerto Vallarta, where it was full of volunteers. The animals that were there, you knew they needed to be there, and the ones that weren't were being cared for in the community. And I think we do have to kind of think about a future where that might be possible. So thank you so much. It's such an honor to hear.
And I'll just say, it's not the only lever. It's just a lever that I see shelters not being allowed to pull, or like really not evaluated. So the length of stay, the outcome piece, more investment in sheltering and community services, but to really think about like both as a means to an end of unwinding the crowding, and as an end in itself that is actually more of service to community and more humane for animals that don't want to come into a shelter at all. They could avoid it. I think it's something we need to look at.
Thank you. Okay, and I know people have questions, and as soon as we get through our speakers, if we have extra time, we will absolutely be getting to those. I'm gonna go ahead and share my screen again as we go to our next speaker. Hello, Monica.
Hello. Hi, everybody. My name is Monica Dangler, and I am the director at Pima Animal Care Center. If you're wondering where a Pima is, we are in Tucson, but we are the county shelter, so we encompass both Tucson, the unincorporated Pima County, and a couple other smaller areas within the county as well.
All right, let me get to you. All right. And here you are.
Perfect. So yeah, in 2023, just a little background for you guys, PAC took in over 17,000 animals, and those are just dogs, cats, and a handful of pocket pets. So we're not including any livestock or other things in there. And we had a save rate, a live release rate of 90.68%, which I'm really proud of with all of the challenges that we all face and we have been facing for the last couple of years. And we've been collecting data for almost 15 years, but we've been looking at 10 years at a time. And that data that we're looking at, there's quite a few different things. We're looking at our euthanasia rates. We're looking at our animal placement rates. We're looking at the number of people that are getting injured for any reason at the shelter. Maybe they tripped and fell, they got bit by a dog, whatever the situation is, we measure that. Number of bites in the community and in the shelter. So if a volunteer gets bit, we're measuring that. If it's Joe Schmo got bit, we're measuring that as well. And then also the number of bites from pets that were adopted from PAC. Right? One of the challenges or one of the criticisms we typically hear is if you don't euthanize animals with bite histories, they're going to create an unsafe community. So we want to make sure that we're measuring of those animals we're sending back into the community, are they reoffending or just offending in the first place? Just a little fun fact, since 2013, we've seen roughly an 8% decrease in overall bites in Pima County. And when we're talking about bites, these are all just dogs and cats that we're looking at. When we look at our euthanasia, you can see in 2013, boy, we euthanized a lot of animals. We euthanized almost 10,000 animals, where now we're in this has 2022. It should have had 2023. We're down to under 10%. You see a dramatic decrease in dogs and in cats. And some of those things are because of different programs we put in place. In 2013, we were euthanizing anything with a bite. We were euthanizing anything we thought was a pit bull. And then you saw that start decreasing when we stopped euthanizing pit bulls. Cats, we started doing a TNR program in 2014. So you can see a significant decrease in cats in 2014. We implemented a lot of different programming in 2016 and 2017, having a robust foster program, a pet support center to help provide resources to people to keep those pets in the community. So lots of other programming has gone into helping us lower our euthanasia. So we wanted to show that. And then when we look at the total number of reported bites, and just so you guys know, reported bites are what we consider legally reportable bites. So it's anything that's going to break skin And that's what we're counting here on these. But you can see from 2013 to 2023, there's been a few drops, but for the most part, we're staying around the same, a little bit lower. However, one thing to know about Pima County is we have been growing by leaps and bounds year over year. So while our bites are remaining fairly consistent, right? There's about an 8% delta. We are seeing our population growing, and you would expect as your population grows that you'd also see an increase in bites in the population because there's just more opportunities for people to get bit. And then you can see the one bite in, or the one statistic there in 2020, 2021, we had those dips during COVID, less people were out interacting. So we saw less bites in the community. And then we look at number of bites on site here at PAC. And these numbers here are both dog and cat bites put together. I should have separated them out because it's pretty interesting. Right, cat bites in 2014 was a big chunk of these. And we were taking in a lot more cats, as well as euthanizing a lot more cats. However, the bites in shelter have gone down slightly. We saw the big decrease in during COVID because we had less people on campus, we had less pets in the shelter, but it stayed relatively the same. One thing to note that we're not able to measure, right, is in 2014, volunteers, staff were not comfortable reporting bites because that meant a death sentence for that dog. So there were probably a lot of unreported bites back then, as opposed to now we've done a lot of cultural work within our shelter that a bite does not mean something bad is going to happen to that dog. That just gives us more information to better place that dog or that cat. So those were the bites there in the community, and then we can earn the shelter. And then, right, we also looked at the number of bites occurring in the community that were from adopted animals. And in this one, we're specifically looking at dogs. So you can see it's about 1 to 2% of the animals, total dogs we're adopting, are biting in the community. You can see in 2014 to 2016, there's a lot higher adoption numbers. They were including adoptions and transfer to other shelters in that number. So that's why there's that discrepancy. But overall, the number of pets being re-released into the community with bites or without bites hasn't changed significantly. If you look in 2014, 2016, even 2017, it's a little bit higher. It's probably about 3% of those animals, but it's not a significant change, which means back then when we were killing those pets that were biting, we weren't changing anything in the community. So why don't we evaluate each pet as an individual and make that happen?
Thanks, Monica. And I wanted to just point out that you have the safety report, which we'll share a link to. And Monica, maybe when you're done speaking, you can share a link to it. But this safety report, I just screenshotted it because every year Monica provides an annual safety report, and it doesn't just include bite data, it includes risk management data, claims that have been made, and it shows year over year the shelter getting safer. And we felt like this is an important thing to share. PAC is also one of my old shelters, and we really, I think, we're able to debunk the idea that euthanasia inherently makes shelters safer. And if you haven't gotten a chance to visit PAC, it's worth it because you can see the extensive number of community programs. The place is packed with volunteers on like a Sunday at 6 o'clock. And there are real reasons that PAC is safe. And so we'll also share a link to a presentation that we did about sort of how they maintain that. But it's a really remarkable story, and I think debunks a lot of what we imagine to be true about animal shelters. So thank you, Monica. Okay, so we have, if you're still with us, you're hanging in there, we have one of my favorite things to learn about, which is from Dogs Playing for Life. We have Emily and Lauren here to talk a little bit about the data from Dogs Playing for Life and what they have learned about safety as they embark on their amazing world-changing dog play group journey.
Thanks, Kristen, and thanks for us being a part of this. We're always super psyched to be a part of these leadership discussions, but also to kind of share what we're learning and share what we still kind of hope to learn. Because as we've mentioned, we don't have a great way of measuring safety in shelters. I think when Dr. Hurley said that safety is the expression of capacity issues, I couldn't agree more, but I would also add that safety is the expression of quality of life issues as well, for both, I think, dogs and people, from our perspective. And so when it gets very tempting to restrict handling, or when shelters feel unsafe due to too much contact, restricting that we see tends to decrease safety rather than increasing safety. So we're trying to really have shelters as much as they possibly can, pour their resources, and be as efficient as possible in getting those dogs out of their kennels for out of kennel enrichment to improve their quality of life. So I'll let Lauren kind of take it away with some of the data we have collected, and what we kind of see as opportunities to collect more as well.
Okay, and I'm going to try to be really speedy without being hard to understand. So we are a national nonprofit organization. We do a few different things, but first we travel around the country and help shelters to implement playgroups for their dogs. As of this morning, we're currently serving our 376th shelter in Louisiana. So what we're doing when we're doing playgroup seminars, we're collecting lots of data from shelters. So they're completing surveys for us both before and after a playgroup seminar. We're asking for some shelter stats, like release rates, lengths of stay. We're also asking for bites. We'll talk more about that later. But we're also asking lots of questions about safety as it pertains to both dogs and humans. And, you know, we have hours and hours of content on all the benefits of playgroups, but it's really important to us to ensure that shelters are staying safe when they're running playgroups. You go to the next. Thank you. So probably most relevant to today's discussion is just how many injuries are happening to handlers during playgroups, because if lots of handlers are getting hurt, no matter how amazing playgroups are in other ways, the shelter's not going to continue the program, right? It's too risky, it's too expensive, the toll on the humans is just too high. So this survey question was, how many handlers have been injured such that they required medical attention since your seminar? And that could be a shelter that had a seminar 6 months ago or 6 years ago. And 94.3% of shelters told us between 0 and 2 handler injuries requiring medical attention have occurred in the life of their playgroup program. That feels pretty manageable. We had a case study. Longmont Humane Society was one of the first shelters that our founder and CEO, Amy Sadler, established a playgroup program at. So we have their data for a 7-year period in which they were running daily playgroups, average of 15 dogs per group. And they, in those 7 years, reported 1 concussion, 1 scratch to the face, and 19 displaced bites while interrupting a dog fight. So that's between 2 and 3 bites a year. Again, given all the benefits of playgroups, feels pretty manageable. What we would really like to be able to report on is dog to human bites throughout the shelter as a whole. As Kristen said, that doesn't give you the whole picture, certainly. A bite is not a bite is not a bite. But our hypothesis has been that those bites will actually go down. And what we've seen anecdotally from some shelters is that they do. That sounds kind of counterintuitive. Dogs are getting out more, they're having more opportunities to bite, but our thinking is that they're less pent up, less frustrated due to consistent, outlets through playgroup. Maybe bites are going down. We're also hearing from 80% of shelters that staff and volunteer handling skills are improving after starting playgroups, so that seems very promising. Unlike PAC, we're really struggling to get bite data from shelters. So it seems like that is an area where we need to be more consistent as an industry. PAC is doing a fantastic job of that. Lots of times when we're asking, pre and post seminar for shelters, annual on-site bites, they just can't provide them. So I think there are lots of reasons for that, but I do think that's something that we need to think about. And then it's important to us to practice what we preach. So I just wanted to give a really quick rundown on what we're doing to track bites and injuries at our canine center. So this is another thing that we do. We run a board and train facility in North Central Florida where we're working with shelter dogs that are at risk for behavioral euthanasia. And tracking our bites really helps us to uncover trends. Maybe we need to use safety gear more. Maybe one playgroup handler is having a lot more altercations that are resulting in handler injuries, so we need to talk to that person. And it also allows us to measure safety over time. So are we seeing more injuries or fewer injuries as we go? Is there some kind of ebb and flow that we can, what can we attribute that to? So we use the Dunbar scale for bites to humans. We're also tracking dog to dog and non-bite incidents as well. We have QR codes that are just positioned around the facility so that people can easily just scan that on their phone and complete the form. We've definitely learned the value of erring on the side of collecting too much information because we never know what we may want to do with that. So definitely bite level, whether the handler needed medical attention, the dog or dogs involved, if it was a playgroup injury, you know, who was the lead, how many dogs were out, which dogs were out, kind of all the details that we can collect. We're also taking pictures of the bite so that we have that record as well. And then, so last year, 2023, we had 25 bites on site. We averaged 33 dogs on site over that year, and then they get out between 3 and 4 times a day. So I did a little calculation that's basically over 42,000 opportunities to bite. So a rate of just 0.06%, which, especially given that we're working with dogs that are a bit more challenging behaviorally, that feels pretty good. Last slide. This is just, we've had lots of conversations with staff. Monica spoke a little bit to getting compliance, and you know, people don't always want to report bites. They also don't always understand what they're supposed to report. So this is one way that we've tried to help staff figure out, you know, what do you need to report and what do you not need to report. So that's my, do you have anything to add, Emily?
No, I think like Lauren mentioned, we're trying to collect more data. We encourage you all to be collecting this data, no matter how scary it might seem, to be really transparent about the amount of incidents happening in your shelter, because it is allowing us to make decisions about programming moving forward. And so that's been really helpful to us. But I think we've left enough time for questions for the whole group.
Thank you. And I just want to say, I think that, you know, I did my first Dogs Playing for Life shelter in training in 2013, maybe. And it is why I have kept people in dog safe. I mean, it is the sole reason I have kept people in dog safe in the shelters that I've led. And I think that most of what I teach today was rooted in what you all taught us. And I'm really grateful for DPFL, because the quality of life issue, seeing the dogs when they get to play and interact with each other, is really, it's so clear when you see it. So thanks, y'all. And if you haven't checked out their website, you should, because it is really, their website has a lot of content on it, a lot of information. You can get started with a lot of things, even without working directly with them. So thank you guys so much.
We do have webinars, and we're looking at a kind of handling webinar coming up. So keep an eye on our website too, because you can join those and learn a little bit about what we're doing for safe handling.
Great. Okay, so there's so many questions, and we have 8 minutes. I want to, does anybody want to say, first of all, do any of our speakers want to add anything that they didn't get to add, or any other thoughts come up as you're looking at the chat? Okay. Well, I guess then we are, you know, people are sort of asking a whole variety of questions, but just in the name of safety, I want to just ask you all a few things that I think, when I am traveling to shelters, make them safer, are appropriate signage, which is lacking in so many places. Also, not keeping the dogs off public view. I've been going to a lot of shelters where the dogs are behind the scenes for weeks. They're on these status holds. They can't be seen by the public, but they can't be handled. And then by the time they come out of their kennels, they're really, really anxious. And so I think, you know, the more dogs can be seen, the more they can get out from day one. I swear by Benebones. I'm such a fan of that company, and every single house dog having a Benebone is like such a great, it's a way to like use their mouths. And using proper handling equipment, just having collars on the dogs. Like there's some basic things, along with safety tools like bite sticks or break sticks. And those are easy to buy online, easy to learn how to use. And fight interruption tools. Those are some of the things that I generally recommend for shelters. But are there things that you all recommend when it comes to safety that you feel are really important?
This might sound like a no-brainer, but walkie-talkies or some version of a communication system to reach other people's in shelters. We visit shelters a lot that have no way of communicating with each other.
And I would say a formalized training, right? We use Dogs Playing for Life to train our staff and our volunteers. And it's important that volunteers are handling the animals the same way to reduce the risk.
I'll also add, right, canine behavior and understanding sort of what the dogs are telling you and what you're seeing and what you're reading. So making sure that that training program includes identification of behavior.
This is, for a lot of shelters, this will be a longer term investment, but can't overstate how much double compartment housing with the ability to actually use it as such contributes to safety. So to be able to provide basic care without having to handle or take animals in and out, it's really hard to ongoing have safety without that.
Yeah, and I know I've heard from a number of shelters that are restricting hours, restricting access to the public to animals in the name of safety and decompression. And I think we do need to do some research on this issue. When I have seen it, it just is keeping animals in care longer. And so restricting hours, restricting time, animals can be seen, like thinking really thoughtfully about those things, because I work with Maui Humane, and one of the things they do is they have it's called like audible hour, where everybody has to be quiet and they play like an audible book for the dogs, but people are still allowed to walk through the kennels. They're just asked to be quiet. And so there's a lot of middle ground solutions that I think like if we can just commit to not doing one thing that keeps an animal in care longer, that's probably the number one thing we can do for safety. And letting them, and then the last thing I want to mention that I think is an emerging problem is the overuse of status holds, like rescue only and awaiting medical or awaiting assessment or awaiting evaluation. Animals are getting lost for weeks to months. I was at a shelter recently where they were lost literally for years in the system, waiting to be released off of a status. These things make shelters fundamentally unsafe, and they're practices that we really have to look carefully at. And I think for shelters here, just looking at one of those, like picking the one that's like, is a problem. I think oftentimes the medical holds is an easy one, not directly related to safety, but it is, because you've just got so many animals sitting there overcrowding the shelter for no reason. But I don't know if that resonates with any of you.
In my old shelter, we did population rounds, and I know that that was something that was talked about a couple years ago. I haven't really heard it recently, but really asking every single animal, what can I do for you today, right? How can I move you through? What can I do for you? And maybe that's one person, maybe that's a group of, where you're at. But I know that that's something that in my experience has been extremely helpful with population rounds.
That's thank you for mentioning that. Utah Humane, I was just there, and in the morning, they do population rounds every day. And then in the afternoon, they do case management meetings every single day, 7 days a week. Their length of stay is like 13 days because they're just constantly moving to the next step. That is such an important point. I think that's a good place to end, Jerrica. So thank you for mentioning that. We want to thank you for being here with us. We are 3 into 6 sessions hosted by Shelter Animals Count and PEDIGREE Foundation, and we're so grateful you're joining us. We will be sharing part or all of this recording along with a recap of this session, but we covered a lot of ground today. If you have any questions, please reach out to us. I'm Kristen. I'm at Outcomes for Pets, and we'll make sure to also share the contact information of the other folks on this call. Thank you.
Bye, everybody. Thanks for being here.